So you've been given a prescription for an ear gel to apply to your animal's ear. You should have received counseling when you picked up the prescription, but just in case you can't remember, or maybe we mailed it to you, then I'm going to go over the different dosage containers that you may have received and how you would use each to apply the dose that you need for an ear gel. So the first thing you would want to do is to make sure that you have either the finger cots, which are these little just basically they go over one finger. You would just push it down over your finger like this. So you can use the finger cots, or you can use gloves if you have some of those. Either one. We usually provide these with the prescriptions, but you're welcome to purchase these on your own. Now, the reason you would use finger cots or gloves instead of using your bare hands is that the medication that's in these particular ear gels can be absorbed through your hands. Now, for some things, it doesn't really matter. Maybe the patient's getting fluoxetine, and so a small amount, you wash your hands really good with soap and water afterwards, and it's not that big of a deal. But if they're getting an anti-thyroid medication such as methimazole, that can be a very big deal, because as humans, we typically have low thyroid levels. We want as much thyroid as we can get. But in animals, they typically suffer, especially cats, from hyperthyroidism, too much thyroid, and so they're normally given medicines and ear gels to reduce their thyroid levels. So you really don't want that happening, and that's the reason why these finger cots or gloves are very important. So once you've done that, then you're going to take the device that you picked up. So the one that we first used was a syringe. So you may get a syringe. This is an oral syringe, but we're using it to dose a topical medication. So on the syringe, there are these markings. This is a 1 milliliter syringe. So it goes from the top all the way down to 1. And there's like 1, 0.9, 0.8, on up. So the top of the black line should be down here when you pick the syringe up with the 1. So this has 10 doses in it. The normal dosage for an ear gel is 0.1 mLs. So it can be less than that, but that's just the typical dosage. So this would have 10 of those doses in here. So you would then pull off the lid, and then you would push up on the syringe just gently until the top of the black line lined up with a 0.9. Then the amount that you have on your finger is the amount that you're going to apply then to the ear. So now how are you going to apply the medication to the ear? So let's pretend this is the animal's ear. So you've got the hairy part on the back, you've got this flat hairless portion here, the ear canal down here. So this is an ear. So a lot of times the easiest way is you've got the medication on your finger, you've got this hairless part of the ear, and so you're just going to take and you're going to apply it, and you're just going to rub this in with the finger that has the medication on it. Now on the back of the ear, you can use your thumb just to rub the back of the ear, and so they just think they're getting a nice ear rub, you know. So you just rub that in until it's completely rubbed in, and then for about 5 seconds past that point, you want to just make sure that it gets rubbed in really well. Now if a little bit goes down into the ear canal, just take it out. You just want to make sure that you rub it in well. If they're going to be around other animals that might potentially lick their ears, keep them separated for at least 30 minutes just to make sure that they can get that absorption into that ear, and so that's not going to be licked off on there. The other thing is that you want to alternate ears. So if you use one ear one day or for one dose, then you would alternate to the other ear for the next day or the next dose. So if you were, for example, if you're doing something once a day, then you do it one day, the next day, just back and forth. If you're dosing something twice a day, then you may want to do one in the morning on one ear, at nighttime on the other ear, and just do it that way. It doesn't really matter as long as you're rotating in some way, so that you're not just using one ear continuously, just because some sensitivity can develop if you continue to just use one ear. So now you've applied the medication, and that's using the syringe, and then you would just discard the finger cot, just throw it away in the regular trash. So that's a syringe, and so a lot of times you'll see those. The next dosing device that you may see, and this is called a Top-to-Click Micro. Looks kind of like an insulin pen. It's not, but so it's going to have the lid on it. So you're going to take that off. You can see that there's an applicator tip. I do not recommend applying this or using this to apply the medication to the animal's ear. You come in a cat once with this, you're not going to be able to get to them again. So even though there is an applicator tip on here, normally I would still put it on your finger and do the ear rub method that we talked about. So on here, you're not going to see the markings like you see on the syringe, but you can see very faintly 1 milliliter, 2 milliliter, like however much is in the actual dosing container. So what you're going to do is, if your dosage, so on the label it should say how much you're supposed to apply. So for example, this one says apply 0.1 ml, again that typical dosage form, 2 clicks. And so what it means by clicks is, so on the bottom you have this little triangle, and you're going to turn it counterclockwise. So when I do 1 click, you can actually hear it click. And so then I'm going to turn it again counterclockwise, 2 clicks. So then the amount that comes at the top, that's the amount that you're going to apply. So you've turned it 2 clicks, and then you're just going to take your finger and you're just going to wipe that off, and then that's the amount again that you're going to apply to the ear, that you're just going to then, again, rub in with the finger caught and the finger until it's completely rubbed in. And then you would throw away the finger caught and just put this on. You would just keep these a regular room temperature. So that's the Topi-Click Micro. It will hold up to 9 milliliters. So then we have another device which is similar to the Topi-Click Micro, but it contains a larger amount. So if someone is getting a 3-month supply, maybe is dosing more than 1 animal, then you might get this larger, which is called a mini ticker. So on here it has the label, like this particular one, they're supposed to apply 0.1 mLs, which is 2 clicks. And so, but the thing is on here, 2 clicks, so on the bottom you have all these little 0.05 indicators. It goes from, so over here there's a 0.5, then 0.10, 0.15, and going on up, and then there's a 1. So, and then there's these little arrows that point, there's about 4 of them around the bottom. So it doesn't matter where you start, as long as you remember, as long as you know that where that arrow is pointing at, that you're going to go over 2 spaces. So for example, on this little line right here, it's at the 0.85. So I'm going to do 2 clicks, again turning the device counterclockwise, and so I'm going to go to the 0.9 and then 0.95. So 1, 2. This one is actually okay. So let me do it again. 1, 2. So the 2 clicks that we're going to have there, and then that's the amount that's going to come out, and then that's the amount we're going to apply, just like we did with the Topi-Click Micro and just with the syringe. Once we get the dose out, we're just going to apply it to the ear, and then we're going to then throw away the finger caught. So those are the 3 different devices that you would have to use for a topical ear gel. And again, it's important that you use the finger cots or a glove, and still wash your hands real good, because just taking the finger caught off, you may get some medication on your hands. So wash your hands real good with soap and water. And if you have any questions, just please give us a call here at Village Pharmacy. Thanks.